Hi everyone, I'm Dr. Justin Lin here at Rehab and Revive Physical Therapy, where we rehab your mind to revive your body. COVID-19 has been with us for the last couple years now, and some people have had longer symptoms and issues lasting longer than the actual sickness themselves. We call it long COVID. And to list a few, there's some issues related to the heart, such as high blood pressure, heart palpitations, racing heart, chest pain or chest pressure, to list a few. We've got a great series of exercises coming up, so stay tuned. But before we do, we would love your support and like and subscribe our video. What we're gonna need is a sink plunger, but today we're gonna call it a therapy plunger. What you're gonna do is you're gonna lie on your back, and we're gonna show you that in a second, and then we're gonna place it in different areas. All right, you're gonna lie on your back, you're gonna hook your legs up, and really the first place we wanna start is your pyloric sphincter. I'm gonna stick this force cup. What you wanna do is create a seal. You might make a little fart whoopee cushion noise. Make sure you've got it. A nice little pressure here. This is an area where it kind of drains some of the debris of the inflammation that's happening. Now you can have fun by finding which direction is tightest. You can go around like a joystick, and for me it goes here and actually pulls all the way to my rib cage. What you want to do next is you want to windshield wipe your legs, and we're just going to do this for about 45 seconds to a minute at a time. So follow along. What happens a lot of these times is your organs are getting clogged up. This inflammation, especially the people that have had high fevers, are really having some issues. Things close up, these organs get messed up. And what we found here at the clinic is that we want to open up this channel first, and then we're going to get into the muscles and tissues around the chest. So in a perfect world, you'll find yourself, if it's tight, you'll feel tension here. You'll also find that maybe you can't go as far with your legs. That's okay, so just keep at it. And also you might find you're having chest issues or chest breathing, chest pressure. That's also a bunch of long COVID symptoms. Joint pain, headaches, all that stuff, fatigue, might be related to just poor circulation, that inflammation attack on your nervous system. I just read in a new study that there's 70% of the people who actually get long COVID symptoms are having cognitive issues like that brain fog, also neurological issues like this heart stuff that we're talking about in this video. So here we go, it's loosening up a little bit more. I want to move to the next spot. So we're going to pick our side over here, right here, and you're just going to follow along here. So go ahead. And right here, right along this rib cage. And it's going to be the direct mirror when I do the other side. So we're going to keep doing this swivel, this windshield wiping. You might feel things on the inside getting pulled, and that's good. Things might move around, things might feel like a worm. So we're going to keep doing this. You can breathe into it if moving your legs is too much. You want to just take some deep breaths. That's also another way to free things up. We want to find expansion. We need nerve real estate. We need our organs to have more capacity. And this also helps things like your lymphatic system, which also clear more of this swelling. Swelling to your nervous system is like throwing water onto a live hot wire. You can imagine it just creates sparks and really shocks the system. So we want to get it back. We want to keep improving that. So a lot of you who are suffering with these symptoms, like, let's get after this as soon as possible. Is this research? No, but this has been working here at our clinic and been helping. And I've been getting after this since 2020 with a lot of our patients who have had COVID. Good. All right, so moving on to the next. Same basically area, we're just gonna do a direct flip-flop here. Why do I wanna go this way? It's going to be really important for that digestive system as well, but opening up the diaphragm. That's really kind of where we're at. We're hitting it from both sides. You might feel a little cramp. If it's there, you just keep going. Some people also use a seal with beeswax. I wouldn't use Vaseline or anything, but you can use like chapstick. Put it around the brim. That gets a better seal to your skin. So we're going to keep doing this. Hopefully you even feel better digestion. There's so many benefits to just plunging these areas and getting more space. Good. Take deep breaths again. Really get more expansion. Yeah, this could be such a painful experience for those of you who've had some of these long COVID symptoms, blood pressure changes. You know, some people also even post-vaccine have had a lot of this elevated symptoms. So now we're right over my heart, my chest. This is the last little bit, and you can see there's actually pressure here. If it's stuck, there's something going on. So I want to create that seal again, and then we want to find that. You might find it pull all the way into the front of your back, which is like a line. We drop a little hook down here. You might feel that whole line. Now, once again, I want to find the biggest bang for my buck, and it's right there, and it's tight. I can do breathing again. Or I can windshield wipe my legs. And you know, my legs, if you saw in the previous 3 other ones, my legs are pretty wide. I can't go very far. I myself have a heart condition, so I have to do this constantly, and found it very helpful, and that's why I'm bringing it forth to you guys now, and a lot of our clients have benefited from this. So just really getting in there and really making that improvement. I can just tell you, overall, I got a little bit more chest expansion. Not sure if it shows up on video, but you know, check that out.
So who knew a handy dandy little plunger was going to make a big difference in improving our chest capacity and opening up our heart and chest so we can move around and have that movement, extra movement for our heart. I recommend you check with your healthcare practitioner, make sure this is a safe exercise for you, and we've actually linked this actual plunger in the description box below. And if you found improvement with our plunging method, please leave any comments and feedback below. And if you haven't supported us already, please like and subscribe to our channel. I'm Dr. Lin. Remember, we heal smarter, not harder.